Hello, students. Welcome in. Welcome in. Thank you so much for being here. See a lot of y'all trickling in right now, so I'm going to go ahead and give it another 30 seconds or a minute for y'all to finishing joining in. If you are just joining us, thank you so much for being here. Thank you so much for being here on time, I should say. Go ahead and hang out here for just a second. Got a lot of people trickling in right here. Want to go ahead and give them time before we get started. Hello, everyone. Welcome in. If you're just joining us, go ahead and hang out here for just a second. Got a lot of people trickling in right now. Want to go ahead and give them some time to jump into the session and get settled. All right, wonderful. I feel like that's a good space for us to go ahead and get started. So hello, everyone. Good afternoon. My name is Javier Gutierrez. I'm an admissions and outreach counselor here at Sacramento State. I just wanted to start out by saying thank you so much for taking time out of your Saturday afternoon to join us for day 2 of Admitted Student Weekend. We know that time's been challenging these last 13 months, and a lot of y'all may still be in school right now, taking classes right now during the semester. So we appreciate y'all being here and taking the time to learn about your new university. This session and this next hour is going to be all about COVID-19 as it relates to our campus and the class format for fall 2021. And we have a couple of guest speakers with us today who are going to kind of give you an overview of what you could expect as a student in your first semester at Sacramento State and how we as a campus community are preparing for the new academic year that's going to start for fall 2021. As far as housekeeping items, this Zoom session is going to be held in webinar format, which basically means that you as a participant, you will not have access to your microphone or camera options for the duration of the presentation, which is okay. The primary way that we're going to go about communicating is through the Q&A feature that's at the bottom of your screen. So as we're going through the presentation, if you have any questions, feel free to just go ahead and drop them in the Q&A feature, and then we're going to try our best to address every single question that y'all may have. The final 15 minutes of this session is going to be an opportunity for our speakers to answer questions live for all participants. So I'll go through and I'll determine which questions that we can answer live. Like I mentioned, hopefully we can get to all of them, but that's okay. We are going to provide some contact information at the end where if we don't get to your question, you can always follow up with us and we can answer your questions via email as well. So if you have any questions right now, go ahead and drop them in the Q&A feature and we'll get to them at the end of the session. But without any further ado, I'm going to stop blabbering on, and then we're going to go ahead and get into the meat and potatoes of our presentation. We're going to go ahead and welcome our first speaker, Vice President of Student Affairs, Dr. Ed Mills.
Thanks, Javier. Good morning, everybody, and thank you for joining us. And I'm very excited to get to see all of you on the Sac State campus this fall. So as Javier said, we're looking right now as a campus at how to repopulate our campus. Like many of you in the schools that you were attending, we all went virtual a little over a year ago. What I can offer, and probably what some of you are experiencing, is it's actually more complicated to come back than it was to go virtual. But we're working hard on that in all of our departments and colleges and all of the services throughout the university. So it is our expectation to be back on campus in fall. There will be a series of different teaching modalities that we'll be using. You probably heard a little bit about some of that earlier this morning for transfer students that you'll be looking at in June when you register in orientation. And for our new incoming first-year students, you'll get a pre-populated schedule that we call Hornet Launch. And then in July, you'll have an opportunity to make some changes to that schedule. And that's important. Everyone will have the ability to make changes again in August. I think it's important because there's going to be some very different mixing of how we teach. Probably 60 to 70% of the courses will be in person. And then we're going to have a variety of courses that might be called hybrid, where part of the course is going to be taught in person, and then there'll be aspects of the course that you do online. There's also some things called HerkyFlex or HighFlex. You'll see some of those when you're registering, and there may be courses where you're choosing to be on campus a couple of days a week, and then actually the other part of your class is going to be on campus those opposite days of the week. So including some of folks may be joining online while there are folks that are in the class. So there's actually 7 different teaching modalities that we'll be using. All of them have their pros and cons and various different learning styles. And so that's why it's important to us that when you're looking at the classes for this fall, you have the opportunity to see what's available and make some selections that I think will work best for you. In addition to that, all of our services are on-campus housing, our food, our rec center, which is we call the Well, which also houses our student health and counseling center. All those areas will be open. We'll have club and rec sports. We'll have all kinds of activities. We'll do it safely, right? So we're gonna make sure, especially in the beginning, there'll be a lot of different scenarios of who's vaccinated, who's not vaccinated. And so we're gonna keep wearing our face coverings in communal areas. We're gonna make sure that we're distancing in whatever is required at that point. I think those requirements are going to change a lot over the summer. We'll have hand sanitizer throughout the campus and all the buildings. So our primary goal is to keep everyone safe. Our primary goal is to offer a wonderful experience for each of you as you join us on Sac State. And we'll keep moving forward as we move through the fall and into the spring. And provide an amazing academic and campus life experience for all of you. So we're working hard on that right now. And I know many of you will have some questions about it, which I'll be happy to answer during the Q&A. So I think I went a little quick, Javier. There might be a couple of extra minutes that we have at the end for me doing that, but I will turn it back over to you to introduce Joy.
Wonderful. Thank you so much, Dr. Mills. I appreciate it. It's been an interesting past 13 months. So, for all of our students, parents, and guests out there, we appreciate y'all being patient with us as we are, making a strategy and a plan on how to, reintegrate back to in-person classes. So again, just thank you all so much. Thank you, Dr. Mills, for your words. I appreciate it so much. And then now we'll move on to our second speaker for the day. She is the Associate Vice President for the Student Health and Counseling Services, Dr. Joy Stewart-James.
Hi, everyone. Thanks so much for being here. We're really so excited to have you back on campus. I have to tell you, you bring the life to the campus, and we sure are excited to have you back. What I thought I'd do today is really talk about some of the things that you can expect this fall as we return to campus, really from a health and safety standpoint. So what I'm going to do is you'll see some of the areas that I'm going to talk a little bit about on the screen, and then we'll have a chance at the end so that I can answer any kind of questions that you may have on any of these areas. The first thing is the general safety protocols, and I think it's important that everybody be aware that every department on our campus has had to submit a safety plan prior to being on campus. And those periodically have to be reviewed and revised as we've changed over the course of the year. So the precautions are both for faculty, staff, and students with respect. And it goes through several levels of review to ensure that we're all aware and that all of the safety recommendations, either by the CDC or the county or the state, are being followed. So we've gotten pretty good at this in terms of looking at that. The Environmental Health and Safety Department on campus has done a great job in reviewing as well as facilities, reviewing all the HVAC, the ventilation systems, the cleaning standards, and things like that. So those have been in place and certainly will continue to be in place through the fall semester. And what can you expect as a student? Well, as Dr. Mills said, it's likely that masking may still be required in the fall, particularly in common areas. There will be more hand sanitizing stations. There's probably more activities and events that would take place outside rather than indoors. that you'll see more frequent cleaning happening, probably less density in some of the indoor areas. We'll have less people in some of those areas. You'll also know that we have a Sac State app, which I'm not sure if you're aware of, but on that Sac State app is an opportunity to do daily screening. And what that does is it walks students through a daily checklist of making sure that they're really safe to be on campus. And the neat feature about that app is that if for any reason you're having any kind of symptoms, any COVID related symptoms, that you have the ability to report those to student health and counseling directly. And I'll go into what happens once we get a report of that. But you'll also see some routine, what we call routine surveillance testing, okay? And I'll talk a little bit about that when we talk about the testing. So those are some of the things that you're likely to see, although it's really important to know that this is a changing landscape. We're not exactly sure what the fall will bring. We can anticipate there will be some changes, and a lot of our protocols are going to be based on really where the state and where our county is this fall. And it's important to know that we're really in a race right now. This is a race between gaining herd immunity and vaccination and COVID variants. Okay, so a lot of that we'll see just how well things progress over the summer. Okay, so let's talk a little bit about the vaccine clinic and where we are. Sac State really became a very early vaccine site. We started in February. We've been using nursing students, nursing faculty, student health staff to provide vaccines to the Sacramento community, the general public, as well as faculty, staff. And just this past week, or just this week, I guess, we've been able to start vaccinating students. The eligibility went to 16 and over. And as a result of that, we were able to start vaccinating students. I can tell you, I'm so pleased with the response that we've received. We had about 500 appointment slots on Thursday and Friday of this week, and those filled within an hour or so. And so there's a significant amount of interest in that. And so we're really hoping that we'll have about 1,200 appointments next week. And as we go through, we're hoping that we can increase that. Of course, it's always based on the supply, although the supply is getting much, much better. So we're hoping that we can continue. And for all of you, we're looking at an opportunity sometime this summer before you arrive on campus to also be able to send you invitations for the vaccine. So that's an exciting thing for us. We have the Pfizer vaccine. It is the 2-dose vaccine. We've done over 15,000, we've administered over 15,000 vaccines since we started as a site. It's gone remarkably well. People have been really, really pleased. So I hope that you'll take advantage of the opportunity that when we invite you, but that's going really, really, really well. The next area is the COVID testing, and that certainly has changed quite a bit since the beginning of the pandemic. We've been doing a significant amount of testing over the past year. However, it's changed, and I'm not exactly sure what it'll look like in the fall and what type, but I can tell you we do PCR testing, we do antigen rapid testing. And it kind of depends on what the circumstances are as to what test is the most appropriate. We do exposure testing. So that's someone that's been exposed to a COVID positive person. We also do symptomatic testing. So if someone is actually experiencing COVID symptoms, we would test them for symptomatically. And then we have what we call a testing surveillance program, where we typically take like a percentage. It might be a random selection. It might be in the fall, frankly, it might be for anyone that is not vaccinated will be put into a testing type surveillance program. That's one of the other positive things about getting vaccinated is you don't have to get tested. So we encourage students to get vaccinated because it does eliminate them from having to undergo the COVID testing protocol. So there will be some recommendations for testing this fall with a surveillance type program. And again, a lot of this depends a little bit. We've not selected exactly the type of testing. If we can get more at-home type rapid tests, we may be able to introduce those this fall. So there will be more on that, but suffice it to say that you will see COVID testing on campus for those kind of purposes. The next is contact tracing. So really what goes hand in hand is testing and contact tracing. So students that either report that they've been exposed to someone that has tested positive for COVID, or they're experiencing symptoms of COVID, then someone from student health will be following up with the student. And essentially what contact tracing is where we interview persons who have tested positive or who are experiencing symptoms. And we collect information. We kind of talk through it to determine whether or not they might require testing, whether or not we should place them in quarantine for a period of time, whether or not they need to be placed in isolation. So the contact tracing is really an interview with the individual. And then from there, we gather any potential contacts that might have been in contact with that positive case. And from there, we also interview them and make recommendations with respect to testing and quarantine. So contact tracing is a really important part of doing testing, because the idea is we want to early identify individuals that may be at risk and reduce the spread. So that's what contact tracing looks like. And it leads into quarantine and isolation. And I think that there's a lot of confusion sometimes about what quarantine is and what isolation is. And quarantine's changed a little bit over the course of this pandemic, but quarantine really is to place individuals that may have been exposed to a positive COVID case, where they're pending their own test results. So we may have tested them, they were exposed, but we've not yet got the results back. We would place them in quarantine. Now, that generally means that we don't want you out and about. That means that you need to wear your mask, you need to stay either in your home or in your particular residence hall, your room, and we make arrangements for meal delivery and things like that. But when you're in quarantine, it means you're staying put. Okay, you're staying at home, you're staying put, and you're not out and about, freely out. Isolation is really when you're sick or you've had a positive test. And as we all know with COVID, there's a lot of asymptomatic individuals. So you may have tested positive, but you may actually not be symptomatic, but that still would place you in isolation because you still are infected, and we need to make sure that you are not coming in contact with anyone else. So isolation would mean either at home or in the res halls, and you'll be moved. You'll be moved both for quarantine and isolation if you're in the res halls. We have designated rooms where we put you so that we can facilitate meal delivery, checking on you, making sure that everything's okay. If you're in isolation because you're not feeling well, you're going to be contacted by someone in student health and counseling to make sure, probably a medical provider will contact you each day and check on you. And so we'll do that. And then it will be the medical provider at student health that will take you out of quarantine or isolation. And so it's worked really smoothly. I will share with you today, there were 2 students this morning that got removed from quarantine today that were in our res hall. And so they get moved back into their room. And that really was a case of pending test results. So quarantine, you're likely to maybe be in quarantine for a couple of days, up to about 10 days. It could be as much as 10 days. Isolation really is dependent upon, when you got sick, when you were tested, and how long and how you're feeling. So that can really kind of vary a little bit. So that's kind of the difference between quarantine and isolation. And those are determined when we do the contact tracing. We determine, as well as any students or that you've been in contact with. We'll also need to interview them and determine whether or not they need to be in quarantine or isolation. So I put this next bullet because this is really an important point, and we really need your help to keep us a healthy campus, okay? We really need, students have done a remarkable job, the ones that have already been on campus. We've got a significant number of them getting vaccinated, and many that have expressed that they wanna be vaccinated, and that's huge. So that's really gonna be real important as we go forward. They're using the Sac State app. There are many programs, many classes on campus that are requiring that those are used prior to attending the class. Particularly a lot of our clinical and our healthcare professions classes, and in some of the field trip areas and things like that, right? That's likely it'll become very, very common. We're going to ask that you report if you're not feeling well, or if you feel that you may have been exposed. We need your help in this, and we're really pretty good, easy to talk to, and we'll let you know. We'll walk you through the steps. We'll walk you through what we need to do. We'll make the arrangements for you if for any reason you need to be in quarantine and isolation. And talk you through that. We'll talk you through testing. We'll provide the testing. If if you prefer to get tested on campus. And so it's just really important that you work with us and make sure, don't wait, okay? Just don't wait. The earlier we're able to do the contact tracing, the quicker you get out of quarantine and isolation, and we can get you tested at the right time. We've seen, just as a note, we've seen over this past year where individuals have become, or they've felt that they were exposed, and then they immediately go to test. And oftentimes they're testing a little too early. So if you let us know, we'll give you the guidelines when the best time is to actually be tested. Again, I'm going to put in another plug for the vaccine, which is if you get the vaccine, you don't have to be tested. So the only reason you would be tested if you've had the vaccine is if you become symptomatic. Then we would test you. We've not had to do that yet, actually. So I'd encourage you, if you don't feel well, don't go to class, stay home, okay? Stay home. And you can always call Student Health, and Student Health has a 24-hour nurse advice line too, so that if for any reason it's later in the evening or you don't know if you should go to class in the morning, you can certainly call that number. So, but I encourage you not, to go to class or work anywhere if you're not feeling well. Make sure you wash your hands often. That is, I think, a skill that everybody has learned this year, the importance of doing that. And then follow all the guidelines that we have on the campus. We put them there not to make life difficult, trust me. It's really to keep you safe and keep us healthy. So we're going to be trying to stay as compliant as we can with what the state and the county recommend in terms of things. So though you'll see increased signage in certain areas. And so all we ask is for you to, respect and do the guidelines, okay, with respect to that. So the next part is actually the fun part, okay? Student Health has really been busy, and we are ready for you to return. So I don't know how many of you know this, but the well, which is the recreation and the health and counseling, we share the building. It's been undergoing a major renovation and expansion. And this project actually was going to take us a couple of years. It was going to be done in phases because of the student population that we had using the facility. And so it was going to be disruptive for students, but we had it phased out over a course of about 2 years. Well, with this pandemic, we were able to take advantage, and we're hoping the target is to open the whole expanded facility by September of this year. So it's really exciting. I mean, it is really exciting. Fireworks, everything. We are really, the renovation of the health center is done. You'll see that we've been able to expand a lot of our areas, and I'll talk a little bit about particularly the student areas where we do internships and things like that. But the expansion area is likely not to be done until September. But we're really excited about this, and this will be great because we won't have to disrupt students when we do return in terms of the construction phases. So we're excited about it. So know that our health center, I'm not sure if any of you have been in the well or know what the well has to offer, but we've got a really full service health center. We have an urgent care center. We have primary care. We have sports medicine, women's health. We have athletic training. We have x-ray. We have a full service pharmacy. So we've got a really robust, comprehensive health facility for you, and your fee covers the vast majority of the services that we provide. There are on occasion, for instance, pharmaceuticals. If you get a prescription, that is something that you'd have to pay for. But traditionally, the visits, there's no copay. There's nothing. I encourage you to take advantage of it. We're convenient, we're accessible, you're able to schedule appointments online. We have a patient portal. You can access all of your results and your notes and everything on the portal. So I want to encourage you to do that. And we are really here to help you through that fall semester with COVID. We have the ability to test. We've been testing. It's our physicians, including myself, that do some of the contact tracing. So we are committed to getting us through this fall semester. So know that about the health center. The counseling services is also, we have urgent care counseling. So that's walk-in counseling. If for any reason you feel you won't need to talk to someone right away. We have individual, we have group counseling, we have workshops, we have peer counselors, And we have satellite offices across the campus and in various different locations on campus. So know that, reach out to any of these resources. They're there for you. We'd like you to be proactive and seek out when you, are wanting to talk to someone, because we've got a number of different resources that we can connect you with. So counseling, and then we have health, wellness, and promotion. And this program is where you'll see some of the expansion, but you'll certainly see a lot of the renovation. So just to give you an idea, 10 years ago when we opened the well, we really only had what we would say, we had about 4 what we call peer health educators. Those are students that assist with outreach. They do kind of some internships and that sort of thing. Well, over the course of this 10 years, we now have over 50 students that participate in that. And everything from nutrition to cooking classes, pop-up pantries across the campus. We have healthy relationships. We have alcohol, tobacco, and other drugs. We have Active Minds. Active Minds, it really promotes and creates awareness about students' mental health. And just this past week, we did our annual Out of the Darkness Walk. It was our 10th anniversary, our second virtual one. We had over 600 participants and raised over $20,000 for mental health awareness and suicide prevention. And Sac State has been a leader in this. We're the top campus walk for the last several years. So these are student really driven. All of the students they can just participate, they can be interns, or they can just kind of volunteer. So there's an awful lot of opportunities to participate in that, but they're going to be instrumental too. And actually, I'm really hoping that they'll be able to kind of get out there and assist with some of our education and promotion regarding COVID. So that and the prevention of exposure in COVID. So there's so many different ways for students to get involved, and I know that everybody's going to want to come to the grand opening and see what's there. But and I encourage you to do that, because you don't want to wait until you really need us to know where we are. So I want you to know where we are, and then if you need us, we're there for you. So let's see, from a time standpoint. I wanted to kind of maybe stop there and see what kinds of questions or maybe that we have, because it looks like, if I see in the Q&A, there are several questions. So would this be an okay time, Javier?
Absolutely, yeah, we can go ahead and jump right on into it. We actually have 9 questions so far in the Q&A feature. But before we get started, thank you so much, Joy. I really appreciate you overviewing those items that are on your screen right there. For all of my students, parents, and guests who are in the session right now, basically the remainder of the time, it's going to be dedicated to answering questions live in the Q&A feature that's at the bottom of your screen. So if you have any questions that you have for Dr. Ed Mills or Dr. Joy Stewart-James, feel free to go ahead and drop them in the Q&A feature, and we'd love to answer those live. But the first question that I have right here is actually for Dr. Ed Mills. It comes from a student, Dr. Ed Mills. I know things are really kind of awkward right now with the pandemic continuing to be a thing. I was wondering what the possibility is of how much my education will be taken online regardless of the pandemic. I know education is important, and I have a small child and a full-time job. I'm trying to make it the most feasible.
And thanks, Javier. Why don't we go ahead and stop sharing so we can see all of us, for those that can. There, hi everybody again. I think that's an important question, and that's really why we are providing so many options. So I'm gonna share my screen for just a second. When you're registering, so if you're a transfer student, that's going to happen in the latter part of June. If you're an incoming new first-year student, that's going to happen in July. And what we'll be doing is, for transfer students, you'll be working with orientation leaders and advisors and going through the different courses that you need based on your major and the classes you've taken to date. And there'll be these different, what we call instruction modalities. The class is the same, it's just how it's being taught. So in person, this Herky Flex being in person or Zoom in real time. That's how I taught my freshman seminar last fall. High Flex in real time, but you can choose some asynchronous course completion options, blended, hybrid, online, synchronous, online, asynchronous. So asynchronous meaning you're kind of doing them at your own pace. So there's going to be options. This set of modalities have out on the website. We actually have a little video we've just finished to help you learn more about it. And so you're going to be able to make changes to your schedule. If you're a transfer student, you can build your schedule that way. And for the person who's asking about being online, yes, it will be possible to try to put together a schedule that maximizes online or hybrid options to help you with your job or caring for your children. As if you're a first-year incoming student, you're going to be presented with a schedule of the courses that we would like you to take, but you can also make adjustments to that schedule. And if you change your mind, either from June or July, depending on if you're a transfer or first-year student, there'll also be 3 weeks before the semester starts in August, where we're going to have open registration, and you can go in and again make changes there. Changes the course, find that same course but in a different teaching modality. So you're going to be able to kind of build your own schedule, and that's the biggest reason that 7 in teaching modalities seems like a lot, but we really did it to try to maximize the flexibility, knowing that each one of you is coming with a different situation, and to the best we can, we want to accommodate those different situations coming into the fall.
Wonderful. Thank you so much. I appreciate that. This next question is actually for Joy. I have a student in the Q&A, Joy, who's asking, are you going to be required to take the self-health screening every time you go onto campus physically?
Great question. Just so you know, everyone has, for the last 6 months, had to do that. So even any of us, any staff, any faculty that come on campus have had to do that. Now it's really only a 2 question, right? So it's quick. It doesn't take much time at all. And if you happen to answer yes to one of those questions, then it will take you to another, it automatically will take you so that you'll report for contact tracing. But it's relatively quick. Now, whether or not this is something that we're going to need to do this fall every day really kind of depends on what happens between now and the fall. If we find that really the case rates are down, the positivities are down, we're reaching herd immunity, we've got a vast number of people vaccinated, it absolutely may not be required at all. So that decision is not yet been made. But know that we've been doing it now for about 6 months, and it's been relatively painless, to be fair. We made it really, really simple. So anyway, I hope that helps a little bit. We'll see.
Perfect. Thank you, Joe. I have another question. I think you mentioned it a little bit earlier in your session, but for new students whose first semester is fall 2021, will they have the opportunity to get vaccinated on campus before the first day of classes? And how would they go about reserving those appointments to get vaccinated?
So actually, Dr. Mills and I have been talking about that. We're brainstorming how to do it. You probably all know that it does require kind of an appointment, and the reason for that is particularly because we have the Pfizer vaccine, which is a vaccine that we have to pull a certain number of doses. We have to have slots and that sort of thing for. So we do it by appointments, but we're working on some strategies on how we can coordinate for students that are coming onto campus for tours or orientation and things like that, how we can provide that opportunity on the day that you come. So we're really looking for that. We have other ways, certainly, that we're doing right now with our students, our existing students on campus, where we've already got their, their names and emails. And when we get, as we're going through, we've got, we send out invitations, and they can click on a link and they can schedule their appointment directly from that link. So we'll have all of your names and email addresses, so we could do it that way, but we're really hoping to try to provide it to you when you come on campus for another activity this summer. Ed, did you have anything else that maybe you wanted to add on that? Because I know you've been working with.
Yeah, I think, our hope, and I hope many of you will be interested in this, is to offer a tour. And again, that we can create a safe situation to provide a tour on campus. Orientation is still online, will still be virtual, but we can provide the tour. And then what Dr. Stewart-James and I are kind of talking about is then how can we, within that time frame, have you, register for the vaccine, get vaccinated while you're on the campus. Then we'll provide you with a box lunch or some goodies, and be able to at least welcome you that way. So that's an option we're working on. But I do anticipate that we will also have the ability, I'm going to hope as we go forward, that we will continue to have the ability, though, to invite you on campus as well, like we're doing with our current students right now. So if that tour or that doesn't work out or isn't part of your schedule, that won't be the only way that we can offer that. And again, students are going to be accessing vaccinations in lots of different places throughout the state. So if you're, viewing us right now and you're down in LA or in the Bay Area, just know there are lots of options for you to be vaccinated. And if you are vaccinated, we're very likely to just ask so that we know that you are as you're coming up. If you're in the region or you're going to come up and be in the region, we'd like to be able to offer that opportunity for you on campus. So you'll get more information about that here probably within just the next month or so as we are preparing for what will happen through the summer.
Thank you so much for that, Ed. I actually have a follow-up question that, Ed, you mentioned a little bit there at the end. Last few weeks, I've been talking with a couple of students who aren't necessarily within commuting distance to Sacramento State. It's probably a little bit of a farther drive for them, who are kind of on the fence between, hey, should I move to the Sacramento area? Should I wait for next semester? What would your advice to those students be who are maybe not within driving distance, who are, thinking about coming to Sac State for fall 21? Should they move to the area? Should they, anticipate that they're going to be able to do the classes online? What would you say to those students?
Well, and it's sort of an evolving answer, as Dr. Stewart-James pointed out a little bit earlier, because things are continuing to change. I do think that it's prudent if you're joining us in the fall to really be looking at where would you like to live in Sacramento. There are going to be, it's not impossible for you to have a fully online schedule, but many, as I said, probably 60 to 70% of our courses are going to be in person or have that in one of those in-person components if it's a hybrid or a flex type of course. And knowing that, we are encouraging students to really think about coming back to the Sacramento area if you're been living if you're living in LA or up in Redding or the Bay Area, wherever you might be right now. There are a lot of living opportunities, lots of living opportunities on campus. Those applications are available now. We're opening a brand new 1,100 bed complex right at the south end of our campus we call Hornet Commons. That's mostly for upper division students, so new transfer students or graduate students. In our north complex, we also have some upper division students there, but the majority of students living there are going to be first year students. And so those options are open and available. And if you're someone who prefers to live off campus, there's a tremendous amount of apartment living around us. But what I would say is Sacramento, the rental market has been pretty competitive in the last few years. And so it's not something I would wait till the last minute for. I would try to make that decision sometime soon so that you have the opportunity to really look at the different living options. And we'd love to have you live on campus if you're from out of the area. We've got a lot of options for you to do that. But just know that as we get closer to the end of the summer, it'll get more difficult because the rental market in Sacramento is pretty competitive.
Thank you for that, Ed. I appreciate that. This next question is for Joy. Will the COVID-19 vaccine be required to be on a student's immunization record that is due before the first day of classes?
No, that is not required. And, you know, so no, the answer is no, it won't be required. And I suspect, you know, we may try to gather that information later through the app, actually, just to determine where we are in terms of the number of individuals at large that are vaccinated, but not necessarily individually. So.
Perfect, thank you. The next question is for Ed. How has COVID-19 affected on-campus housing and roommates, and will it continue to be affected for fall 21? There you go. Yeah.
Unmute myself. I've started to see T-shirts now that say "unmute me" or something. It's pretty funny. The Zoom culture that's developed over this past year. I think that's an important question, and it has impacted us. We normally in our North campus complex, we'd have about 2,100 students living there, and we've had just under 400 students living there. As we're moving into the fall, we're going to have a much larger number of students living on campus. And so it is important for us to make sure. It's one of the reasons that Dr. Stewart-James said we want to collect the information. It's important to us to know who's vaccinated, who isn't. You know, some people may decline to stay, and then we'll look at that as potentially, no, I'm not vaccinated. And then we'll do room assignments. Room assignments, you have a lot of options for as we go through that part of the process in the summer. One of the things that'll make it more complicated this summer is whether or not someone's been vaccinated. And we have a lot of different types of rooms, many of whom where someone has their own bedroom, but there's a common living space. Others are traditional, what you might have thought of as traditional dormitories, which I'm not allowed to say that, they're called residence halls, and where you have two students sharing one room. And so, you know, we'll work through all of that with all of the students living on campus. And we have to maintain a small group of rooms as well, as Dr. Stewart-James pointed out before, in case a student needs to go into quarantine. So we won't be 100% full. We've got to maintain a group of rooms to allow that activity to happen as well. But yeah, that it is going to be part of the roommate selection and room selection process for us on campus this year. And I know it's going to impact students' decisions in rooming with individuals off campus too, although they'll do that themselves.
Perfect. Thank you, Ed. Also, another follow-up question. This could be for Ed or Joy. You guys might want to both, you know, take a stab at this one. But as far as, you know, returning to campus, you know, students are returning to campus at some capacity for fall 21. Students asking, what about amenities and services like library, the gym, certain offices like the student service center, games rooms? Will those be open for fall 21, or will those continue to be closed?
No, we will open again based on the county and state CDC guidelines. And so again, depending on, as Dr. Stewart-James said earlier, where we are in August. I mean, think about where we were 4 months ago in the country, you know, and then where we could be 4 months from now. But yeah, we're ramping up everything. And so it's possible that some areas could have some reduced capacity. We have a very large games room in our union, and instead of seeing it completely full, maybe it's half full. You know, and again, we may be asking individuals, and we will be asking individuals in communal areas to keep wearing a face covering in those times. That's probably one of the most effective things that we can do to prevent transmission of this virus. And And as we've noticed, I think nationally this year, lots of other viruses, you know, the flu rates were way down, common colds were way down. It's really an effective way for us to protect ourselves from getting sick. But yeah, our amenities, our food service, you know, all of that we're ramping back up. The real question is at what level? It's not that it will or won't be provided. It's just at what level will we be able to allow students to access how many students at any one time? Joy, I don't know if you want to add to anything.
No, I think that's exactly right. At this point, we're looking to open everything, but there just may be some changes or limitations. And it's likely to be more of a capacity issue in some of those areas. But again, a lot of this does depend on where we are as a county. But you know, if we continue to move in you know, a positive direction that we're in right now, we can expect that all of the services, including the recreational services, will be open and available.
Yeah. And we're adding some outdoor spaces through the summer. Yeah. That'll be shaded. That'll have, I guess we'll call that a canopy over them, because we know that we need to do more stuff outside. We have a beautiful campus. While in August it might be a little warm, our campus is typically a very beautiful place to be outside, and so we'll offer more outdoor spaces as well.
Perfect. Thank you so much for that. This next question is for Joy. What are the circumstances where a student would be quarantined or isolated? I think the student is referring to in the residence halls.
So a student that has either reports that they have been exposed, or through contact tracing, we determine that they may have been exposed to someone that's positive, they would be placed in quarantine in the res halls, okay, until we either are able to get test results that clear them, so that the individual may not, that they were exposed to, may not have had COVID, or they don't. So that would be quarantine. Now, a student would be placed in isolation if they begin to develop symptoms. They become symptomatic and we test them, and they in fact test positive for COVID. So those would be the two kind of differences, but in both of those cases, they'd either be placed in quarantine or isolation. Of course, it's important to understand that if a student does not live on campus, maybe lives in an apartment or lives at home, then we would just provide them with guidelines and they would do that at home, right? So that we would encourage them to self-isolate in their room, have someone arrange for them to bring them food, check in on them, and that sort of thing if they're at home. But we would not bring you on campus and place you in quarantine or isolation, right? We would ask you to do that at your place of residence.
Got it. Wonderful. Thank you so much for that, Joy. And I have a question right here from a student. Is there an option for a student who's taking an in-person class to attend class online while they're in quarantine or self-isolation?
Yeah, and so we've done some of that this year, and so you work that out with your professor directly, and that actually happened to me. Of course, my class was online, so it was pretty easy, right? But for some of those classes that we had that were in person, yeah, you want to connect with your professor, and if that class is either, a lot of times the professors are recording the lectures. And so that's available through the department or on their website. You might be able, a lot of students honestly are also recording lectures. And so you may be able, like you would get notes from a classmate, you may be able to connect with them. But yeah, I would reach out directly to the professor, let them know your situation. And our faculty have become pretty good about making those kinds of accommodations with students.
Wonderful. And then one last question, and then we're probably gonna have to wrap it up here in just a second, give students enough time to get to the next session. Is student asked right here in the Q&A, and a lot of students have been asking me this the last few months. Is campus open for me to go in and walk around campus right now just to get a feel of campus?
Yeah, sure. Welcome. You're welcome to come to the campus. Our campus is a public space. So it's a big park. If you haven't been on it, it's a beautiful, you're going to see lots of people, walking their dogs or pushing strollers or all of that. Our request is we do have a request for everyone to be masked while they're on campus. And definitely anywhere indoors when they're on campus. So not all the buildings are open and accessible right now. We don't have all the buildings open. There are some, but you're always welcome to be on campus and take a tour or walk around the campus. It is a beautiful space, and depending on your level of allergies, everything is in bloom right now. So if you're an allergy sufferer, that you might have to need some Flonase or something, but it is a gorgeous place. It's a beautiful campus.
Absolutely. There you go. Well, Ed, Joy, thank you both so much. I think we had, Joy, just one last slide that you wanted to share about additional questions. Let me go ahead and share my screen with y'all right here real quick. If you want to go ahead and talk about any additional questions that we maybe didn't have a chance to get to in this session.
Yeah. So if we didn't get a chance to, are you going to share that one? Okay, great. So if we didn't get a chance, if you had some questions, or if another question comes up after this and you'd like more information, we've got a email set up for COVID questions. I'm not sure it's up yet, Javier. So I think he's working on it. There it is. So there's the COVID question email, and you can email the questions to that, and we'll respond that way. If you've got any questions specifically about student health and counseling services, don't hesitate to email me directly. Email your questions regarding that, and I will likely, I may respond, or I'll give it to one of the other directors in either health counseling or health and wellness promotion. I'll connect you with them so that they can respond to your question. So those are two great contact emails for you.
Absolutely. Well, Ed, Joy, thank you both so much. I appreciate you both for taking the time out to chat with our, admitted students, parents, and guests for fall 2021. Did either of you have any, final tidbits or pieces of advice or things that you wanted students to take away from this session? Ed, if you want to share any last things.
Sure. I did drop my email in the Q&A ones, because it's always okay to email me as well. It's just my first initial and last name, emills@csus.edu. I'm also one of the people looking at that COVID questions email, so you might get a response from me. The two things that I would offer, one is that we're so excited for you to join the Hornet family. We do think of ourselves as a family. We're a big university, 31,000+ students, but we try to really make it feel like a small place where folks can really get to know each other. And so it's very exciting for us to have you join us. The one piece of advice that I would offer to you is that we are just totally devoted to email. And so as a student, email is probably not your world that you check every day. And we do have lots of social media and different things that we do, but please do check your email. In the middle of all those other things are going to be some really important emails that we don't want you to miss. And so we're very email happy on the campus, so check your email.
Wonderful. Thank you so much, Ed. Joy, did you have any final tidbits or pieces of advice that you wanted to leave the students, parents, or guests with?
I'd just like to say, get vaccinated. We want people vaccinated. And also really reach out. Student health and counseling has an awful lot to offer students, and we can help you navigate a lot of different things as well. So by all means, come and see us. We'll have a large grand opening, and but reach out, email if you've got any kind of questions in any of those areas. So we're looking forward to having you on campus.
Wonderful. Ed, Joy, thank you both so much. I really appreciate it. To all my students, parents, and guests out there, I hope you learned a lot in this session. This is not the end of day 2 Admitted Student Weekend. There is a live virtual tour that is going to be happening here in about 30 seconds at 3 p.m. So I went ahead and I put the virtual tour link in the chat feature that's at the bottom of your screen. Once you click on that Zoom link, it's going to ask if you want to leave this session to join the new session. So go ahead and join that session. That's actually getting started here right now as we speak. So go ahead and head on over there. Like we've talked about, we are anticipating a return to campus for fall 2021. So you're definitely going to want to attend that live virtual tour. If you haven't seen the campus already, it's an opportunity for you to know where things are at and to ask questions to our student ambassadors here in admissions and outreach. But without any further ado, we're going to go ahead and end the session right there. Thank you all so much for attending this session and taking time out of your Saturday afternoon. And fingers crossed, we'll see you all in fall 2021. Take care, everyone.